skin, broken bones, improper bandage application, infections, these are all things that could happen if you do not take the proper safety precautions when working with a large animal. We are the Maquoketa FFA chapter, and this is our Vet Science CDE Practicum. I'm Brooke Lapke, and I will be the veterinarian. I'm Madison Lapke, I'm the narrator.
I'm Cassie Miller, and I'm the farmer.
I'm Courtney Becker, and I'm the veterinarian's assistant.
Hi, I'm Dr. Lapke. What is the problem with your animal today?
Well, I was out checking in the pasture, and I noticed that he had a cut right above his left hoof, and I was wondering that if you could check it out. I didn't want to risk an infection, and I didn't want to lose loss in production.
All right, well, thanks for bringing him in. We will check it out and get a visual of it. Yeah, it looks like he's got a cut on the lateral aspect of his left hoof, right above the coronary band. When working with large animals, you need to practice in a manner that will keep both the animal and the person working with the animal safe. By restraining the animal, you are able to practice in a quick, effective, and safe way. Today, we will be demonstrating how to restrain and properly wrap the leg of a calf.
See, the head of the calf is restrained by a halter and also by the head shoe. And the body of the calf is restrained so that it can't move side to side. And the veterinarian and I will be working on the outside of the chute so as to demote the risk of injury to me or the doctor.
I've got my gloves on and I've got my rope, and we are now going to restrain the leg using a pulley system and pull the leg up and restrain the leg tightly to the shoe. I've got the rope attached to the leg, and now I'm getting ready to pull the leg up and attach it to the shoe. I've got my assistant here holding the rope to hold the calf. I'm going to put on some gloves and apply an antiseptic scrub to the wound.
The supplies needed are latex gloves, gauze, cohesive wrap, tape, antiseptic, and alcohol.
The hoof has been cleaned and removed of any debris, and now I'm going to use an antiseptic scrub to clean the wound. I'm going to scrub and work from the inside out. Once the scrub is done, I'm going to apply some alcohol to it. And I'll do this 3 times. Now I'm going to take a gauze pad and apply some antiseptic to it to place on the wound. And I'm going to put some extra gauze pads on it for more padding. Now I'm going to use a cohesive wrap to place around the... I'm going to wrap right above the hoof line, applying a little bit of pressure, but not too much. I'm going to use a figure 8 system going between the claws. Now my assistant will cut the wrap for me. Now I'm going to apply some tape around the cohesive wrap. I'm going to apply it so half of it is on the vet wrap and half of it is on the skin. The tape keeps the cohesive wrap in place. So I cleaned the hoof and the wound, and I applied an antiseptic scrub and some alcohol, and I did that 3 times. And then I applied some antiseptic on a gauze pad and laid it on smoothly so there were no wrinkles, and put an extra pad on for padding. Then I applied vet wrap at a 45-degree angle and applied it so that it was smooth and there were no wrinkles. And I taped around the top of the vet wrap to keep it in place so it assured so it wouldn't fall off. And after doing that, I checked the foot and there was no inflammation around the wound, and the rectal temperature seems okay.
So is there anything special that I need to do when I get my cat home?
The wrap should stay on for 3 days, and you should make sure that he's eating all right and moving all right. Then you can bring him back in, and I will take off the wrap and re-examine the wound.
All right.
We would like to thank our sponsor, Rolling Hills Veterinary Services, with Dr. Tom Lackey for letting us use his building and supplies. We are the Maquoketa FFA chapter, and this is our Vet Science CDE practicum.